Okay, so now this starts the newborn nutrition component of this lecture. I had a previous lecture that was recorded for the newborn transition, and I've always done the newborn nutrition part in the classroom because I love to lecture this part. Um, so I'm having to record it separately, and this is why you'll have two YouTubes on it. The American Academy of Pediatrics recommends breastfeeding only the first 6 months with a continuation to 12 months. Currently, there are 75% of infants that are breastfed at birth, 50% by 6 months, and 25% up to 1 year. Now, these are some old statistics, so I am hoping that actually those have increased some. But probably one of the biggest takeaways that you can have with the breastfeeding at this point is that fed is best. And I'm a big proponent of breastfeeding, but I'm also a proponent of understanding when maybe too much is too much for mom. Maybe if she is not dedicated and committed completely 100% to breastfeeding, that we should not encourage something that she's not on board with fully 100%. So the benefits to the infant: they get live tissue containing living cells. It is safe, it's fresh, the nutrients are easily absorbed, the antibodies and immunologic factors are there present. They have decreased allergies among high-risk families. Uh, Less SIDS deaths, possible protective against childhood lymphoma and IDDM. And it may enhance cognitive development. It does provide passive immunities, especially IgA passed in breast milk. The milk is nutritionally balanced for the infant, and one of the benefits will be to an increase in resistance in bacterial or viral illnesses. And you'll hear I had one of the best pediatricians in the world. I attempted to breastfeed one of my children, excuse me. By the time I had the second one, I was just like, oh no, that did not go so well the first time. I refused to do it. And so by the time I had the third one, I was bound and determined I was going to breastfeed him. And I did, and I successfully breastfed him for 13 months. And I had developed mastitis at one point, and also I think I got the flu. And so my gynecologist, when I called them, that's who I thought I should call. And they said, you just need to stop breastfeeding and you need to give formula. Well, I tried once, and he threw it all up, literally threw it all up. And I was bawling hysterically, and I called my pediatrician, and she called me back herself. Do not stop breastfeeding. You breastfeed through it, because the baby is going to receive all of this passive immunity against these viruses that you have. So it's a good thing to be able to do so if mom, and that's the biggest kick right there, if mom is willing to do so. The maternal benefits: there is decreased risk of some cancers. It promotes uterine involution and decreases the risk of hemorrhage. There's a quicker return to pre-pregnancy weight, though I would argue that one. This is just research and what it says. Possible osteoporosis prevention, and there is bonding. It's convenient, it's portable, and it's cost saving. Absolutely, on all three of those. Now, contraindications for breastfeeding: cancer therapy or breast cancer, maternal exposure to radioactive compounds if they have active TB, HIV, herpes simplex, substance abuse, maternal meds such as lithium. We certainly don't want mom to stop taking her lithium. And human T-cell leukemia. Choosing a method of feeding: this is a parent's choice. They need to be discussing this choice with their partner. They need to be taking some classes so that they can understand the benefits of breastfeeding. They need to talk to their peers. Although I always say you be careful who you allow to speak into your life, because some peers may not be the best ones to talk to. Counseling programs. Cultural influences are real big on defining whether a person decides to breastfeed or not, and the comfort level also of the mother. Whatever the choice of the mother, our job is to support her. I think it's time in healthcare that if mother chooses to breastfeed, that we begin teaching them signs and symptoms of failure to thrive, because fed is best. we want to definitely teach hunger cues and be an advocate for the mother and the infant versus just breastfeed through it. Um, and a lot of times that's what you'll find on the postpartum units. I worked it, I know. We tell them, just put the baby to the breast and let the baby feed. And there's some stories out there that are there's unknown causes why moms might not produce breast milk, and or unknown to the mom at that point in time. So I think we need to start looking at moms on an individual basis and understanding why that they can breastfeed or why they cannot breastfeed, and being able to teach all the important things about making sure that the baby is taken care of. Here's a story, and I'm just going to paraphrase this. When I say fed is best, because she happened to be trying to breastfeed. She did not know that her infant was failure to thrive. She did not know that he was not getting nutrients. She just knew that he cried no matter how much he was on the breast, and he would stay on the breast for a long period of time, and then he would be off, and he was never satisfied. But everybody kept telling her to just breastfeed through it. Your milk will come in, and breastfeed through it. He's getting everything that he needs. He didn't. He went into cardiac arrest. He was dehydrated. So I really caution anybody in this point, at this time and stage of the game, to not just encourage moms for no rhyme or reason. I think that we need to teach appropriately. If they want to breastfeed, I'm all about breastfeeding. But I also want to make sure that I'm thinking along the lines of patient safety and along the lines of patient safety for where the infant is concerned. Breast milk contains 20 calories per ounce. I'm not going to go through all the calories here, but you can see how many the infant needs at the first 3 months, the 3 to 6 months, the 6 to 9, and 9 to 12. They should have about 40 to 45% of their carbohydrates in their diet calories. Lactose is most abundant carbohydrate in the diet up to 6 months. And the fat is 15% of the calories. The 15% of the calories should come. Human milk, it is fat. It is easier to digest. It has essential fatty acids that are required for growth and tissue maintenance and skin integrity. It has protein necessary for new cell formation. It's fluid. Infant needs about 150 to 250 mils per kilogram of water intake in the first 24 hours. I'm not in the first 24 hours, in 24 hours. It has vitamins and minerals, calcium, iron, and each breast has about 15 to 20 lobes containing acini. These are breast epithelial cells that form hollow mammary gland sacs. All women can lactate, but some may not be able to breastfeed exclusively. They just might not be able to be. I've said this in lectures before about my daughter that had an IUGR baby. She was just one of those that I thought if anyone was going to have problems with a pregnancy and be high risk, it would not be her. And if anybody was going to have problems with breastfeeding, I don't expect it to be her. And I'm telling you, she just had the worst time being a high risk pregnancy, and she could lactate, but she did not, and it was not from lack of trying. She just did not produce the volume of milk that was necessary. So consequently, we have babies that are 13 months apart because she was using breastfeeding as a form of birth control. You get the fall in estrogen and progesterone that trigger the release of prolactin, and prolactin it accumulates in an abundance at night. That is what helps to produce the breast milk. Prolactin is produced in response to the sucking infant and emptying of the breast. So we really don't want mom to, if she's going to exclusively breastfeed, we do not need her to exclusively breastfeed and let baby sleep through the night. I think that if we have a baby that's within the first few months, you need to be waking that baby up. If a 4-hour stretch is great, maybe even a 5-hour stretch. But if you had a baby that's sleeping all night, you're probably going to see a decrease in the amount of milk that you produce for the day. It is supply and demand. Incomplete emptying of the breast with feedings can lead to a decreased milk production. The posterior pituitary hormone, oxytocin, it has that letdown reflex. It's what causes that letdown. It stimulates uterine contraction during labor, and it does after delivery as well. The anterior pituitary hormone is prolactin, which we just talked about on the previous one. It's responsible for milk production. It releases in mass quantities at night, so not encouraged to skip the night feedings. So those mother's more hormones, the prolactin and the oxytocin, are what helps with that milk production. It's that supply and demand. And moms will get a nipple erection reflex as well. They might not have the letdown reflex within the first month of breastfeeding, but some women don't get it the first month. Some women do. Some women get it after a week or 2 weeks. Their baby starts to cry, and all of a sudden, whew, I'm engorged right at this very moment because my milk has let down. And that reflex, and even the nipple erection reflex, is stimulated when the infant cries, when it sucks, when you hold the baby against the breast, the nipple will become erect, and it helps the milk propulse out. And this varies from individuals. As if they have flat or inverted nipples, it may not happen for them. They may have to use some nipple shields, but we'll talk about that. Human milk is specific to the needs of the newborn. It varies if the infant is premature or term. Antibodies for some broad spectrum protection. It increases the resistance to bacterial and viral illnesses, but will not completely protect the infant from becoming sick if it comes in contact. Lactogenesis. The composition and volumes vary with the stage of lactation. Stage 1, you have the beginning of pregnancy. Stage 2, the milk coming in 3rd to 5th day. Stage 3, approximately 10 days when the mature milk is established. And let's talk about the foremilk and the hind milk real quick, because those are really important. That foremilk is it's really kind of thin. When I talked about how much the baby needs in fluid, well, that is that foremilk. That's where when you put baby to the breast and they start to suckle, then they get that foremilk, and it's milk. It's got all everything that it needs with it. But it's actually quenching baby's thirst. It's the hind milk that we want. And when you work in an ICU, you find out that you want that hind milk because it is so rich in fat and protein and all the nutrients that an infant needs. So we want moms to keep pumping and pumping and pumping until they get to that hind milk. And then you can also see it in a bottle when you see that the stuff that like kind of settles at the bottom. It's really thick and it's full of fat. So it's really important that mom finishes with that one breast and gets through the foremilk to the hind milk. Now, if baby is full after having that one breast, we highly encourage mom to pump that other breast because we want complete emptying of both breasts. Mothers can produce 720 to 900 mils of milk per 24 hours. And that when babies have growth spurts at 10 days, 3 and 6 weeks, 3 months, and 4 and 6 months, then they're going to have a bump up in their milk production. And those are the times that they're going to find that they've been moving along. We're at 10 days now, and all of a sudden, what is wrong with my baby? Because when I try to stop breastfeeding him, I'm telling you what, he sucks and sucks and sucks and sucks, and then he just wants to keep moving. He wants to keep going. We go from breast to breast to breast until he's finally settled. And then I think I put him down for 30 minutes and he's ready to go again. We have to encourage moms to let baby go again, because at that 10 day, they're having a growth spurt and they're suckling at the breast. What do we know that it does? We know that it's supply and demand. And so they are demanding more supply. They need to be able to suck at that breast as much as they need to or want to so that they can build that supply up. Care management for the mother. We need to assess the knowledge. We need to look at cultural factors. We need to look at physical limitations, psychological readiness. What about their support system and a physical assessment? We need to see what's going on with mom's breast. If she has those inverted nipples or she has flat nipples, then it may require her to have a nipple shield so that the baby can pull that nipple through the shield and get it in there and get the milk out. Because just latching on just at the nipple is not what we need. The baby needs to be able to latch at the areola, and they might not be able to do so if mom has really flat or inverted nipples. There's nothing for them to grab a hold of, nothing for them to feel. So it's all work. I'm not going to lie. Breastfeeding does take a little bit of work. So we need to make sure we're doing a good physical assessment. What about the infant? What do we want to do for them? We need to determine readiness and ability of the infant to breastfeed. We need to make sure that we're assessing during feeding for latch on and swallowing. We want to see suck, suck, swallow. We want to observe post feeding. Are they content? Are they sleepy? Are they eliminating? Okay, so baby, the first 24 hours, we want to see at least one wet diaper and one stool. By day 3, we want to see 3 to 4 wet diapers and 1 to 2 stools. By day 4, 6 to 8, or day 4, we want to see 6 to 8 wet diapers and at least 3 stools per 24 hours. And if they're breastfed, let me just tell you, they can have a bowel movement with each and every time that they breastfeed. The mother should notice that she's starting to have lighter breast. She'll have uterine contractions while the baby feeds, and she's going to have some increase in lochia. So you have some nursing diagnoses. I'm not going to read through these. These are things that you can read through. How are we going to implement the care? The ideal time to begin is within 1 hour after birth. Remember me talking about that. The infant's alert. It stimulates the oxytocin. It promotes bonding. It helps that uterus to clamp down and decrease in the amount of postpartum hemorrhage. There's different positionings, and I'm actually going to post another video, YouTube video, and I really want y'all to watch this on breastfeeding. And this is the newborn crawl. I really want you to watch it. It is very, very interesting. But positioning, looking at a football hold, the cradle hold, modified cradle, side lying, and across the lap. And they see these wonderful pillows these moms have, some of them, a couple of them in this picture. My daughter actually had one that was the most awesome in the world, picked it up at the breast center. And she could attach that thing around her. And it just really fits on your hips really well, or around your waist really well, depending on how tight you get it and, where your hips are. Some people have a shorter torso. And actually had a little spot on there to kind of raise the infant's head. And she actually walked around when both the boys were little, walked around with this pillow around her, breastfeeding them. And it was kind of a lifesaver, especially when she ended up with one that was 13 months younger than the older one. Latch on is really important. Mother can lightly touch the baby's lower lip with her nipple to stimulate the mouth to open. We need baby's mouth to be wide open. When the mouth is open, they bring the baby to the breast. And we want to avoid nipple trauma, so don't let the baby attach to the nipple. We want the nipple in the mouth along with the areola. And then we want to see signs and symptoms of milk letdown. What do you think that would be? Is that something that we're going to see on mom? Because I want you to think about that. It's not something we're going to see on mom. What we're going to see is with baby that they're going to be doing suck, suck, swallow, suck, suck, swallow. If they're not swallowing, then that means that they're not getting anything. So we need to know that mom's milk is letting down, and that's a way that we can assess. Newborns require 8 to 12 feedings every 24 hours. Once an infant is feeding well and gaining weight, they can go on on-demand schedule. We want to avoid strict schedules because what did I say? It's supply and demand. But you need to adhere to those feeding cues. Don't ignore the fact that your baby is having is wanting to eat an extra amount at 10 days old and just put a pacifier in his or her mouth. It's something that we need to make sure that we teach moms. We also need to teach them early feeding cues and late signs. Early feeding cues is when that hand is going to that mouth and they're getting it moving on up there. They have those mouth and the tongue movements. They start rooting. They're getting restless. They have a tense posture. They're smacking their lips. The late sign is crying. There's only one late sign. When baby is crying, we've waited too long to initiate a feeding for them. And now listen, duration of feeding. That we cannot go by this because supply and demand. You don't need to stop the baby at 15 minutes and say, "Oh, you fed 15 minutes. We're done." We need to encourage moms to at least breastfeed for 30 minutes. It takes a little bit longer for a baby to breastfeed than it does for them to bottle feed. When breastfeeding guidelines suggest to try not to supplement with formula or use bottles, and only occasionally use pacifiers, excuse me, and have mother to start feeds with the alternating breast. Let me back up to the pacifiers real quick. Remember how I said something about earth mamas? Earth mamas are the ones, I don't know, maybe I didn't say it. I always talk about earth mamas in some of these lectures. But earth mamas are the ones that they don't want their babies to have anything. They don't want them to have immunizations. They want everything to be all natural. So I have a really good friend who is, she's done lactation at the hospital. She's delivered all but one of her babies at home. And she's an earth mama. I love her. And she said, I used to tell my patients all the time, even though I did lactation, that it's okay to give yourself a break for just a little bit and put a pacifier in baby's mouth. There's not a problem with that. But on her, I think on her fourth or fifth baby is the one that she decided that, oh, I've been feeding and feeding and feeding, and I'm just going to put a pacifier in her mouth. And she had nipple confusion. Completely received nipple confusion. She said, I'll never tell one of my patients that again. So, you're going to hear different lactation consultants say different things. It's really up to the individual, but there is always a risk that baby is going to have some confusion with nipples. So pacifiers may not be appropriate until baby learns how to breastfeed well. Some special considerations with breastfeeding is if you have a sleepy baby, it's hard to wake them up to breastfeed. You usually have to unswaddle them, get them a little exposed to the cool. But as soon as they get skin to skin, they're probably going to want to go sleepy sleep again. Fussy babies are hard to get latched. Fussy babies, they need to be calmed down. They need to, we got to work with them just a little bit more. Get them nice and calm and feeling good again so that you can put them to the breast. Slow weight gain. Typically newborns will lose 7 to 10% of their birth weight in the first 3 to 5 days. Then they're going to gain about 110 to 200 grams per week or 20 to 28 grams per day. An infant should regain his or her birth weight by the 10th or 14th day. So by the time that they go see their pediatrician for the first time, they should be if not at their birth weight, close to their birth weight. But if they are not, and they're not gaining enough, they might, we might have to initiate some supplements. And you don't have to supplement with a bottle and a nipple. You can supplement with some syringe feedings just to get this baby's birth weight back up and get everything stimulated to working in the right direction. With preterm infants and twins, breast milk is an ideal food for preterm infants. And you can get 200 to 500 kcals per day for each baby. And let me tell you, I always tell moms that your breasts do not know in the first, when the milk comes in. So in the first couple of weeks, the breasts do not know if you are feeding one baby or 100 babies. That is the time that you are going to produce the most amount of milk. So it's always best, and I'll say, pump, 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 especially if you're going back to work, and put that milk in the freezer. And that's what I've encouraged both my daughters to do. And I'm telling you, it really works because they don't know how much it needs to produce. The breasts do not know. So that is a time that you can get a really good bump. That's the thing to tell moms. You can tandem nurse with twins. There's not a thing wrong with nursing twins. You can do them both at the same time, as you see my mom here on this picture doing. Again, with the expressing and the storing, there's hand expression. I would never encourage that because that's going to be very time consuming. There's pumping, and a lot of insurance companies will cover a breast pump now. We can refrigerate it for 48 hours. You can freeze it 6 months to 1 year. And now that's going to depend on where you freeze it at. If it's just a regular refrigerator freezer, you might want to do around 6 months. If you have one of those chest refrigerator freezers, or one of the, a big freezer that's all it does, you can actually go up to 1 year. You also need to date the containers because you want to make sure you're using your oldest first. Do not refreeze it, and do not microwave it. Do not even microwave formula for that matter. A balanced diet is essential for moms. 200 to 500 extra calories per day is usually what is required. And we want them to drink 2 to 3 quarts of fluid daily. Just chug. Breastfeeding makes you thirsty anyway, so just keep a jug of water there. That's what I did. I just kept a jug of water and I just drank. We want to avoid losing large amounts of weight quickly. Remember I said that I kind of disagreed with the whole weight loss thing. I did the complete opposite when I breastfed. Of course, I had some extenuating circumstances when I was pregnant with my third one. I'd had a bad car accident, and my 7-year-old was in the hospital with a traumatic brain injury. And so I just did not gain weight while I was pregnant. Of course, I was stressed. And when I delivered, I don't know, things just kind of seemed to settle down at home. She ended up coming home, and things leveled out, and I just gained weight. I was not one of those that lost. There's no restriction on exercise, and rest is also very important. We want to avoid soap on the nipples, no breast creams, no vitamin E oils or creams. And modified lanolin is what is usually recommended, as long as they don't have a yeast infection. If they have a yeast infection, then likely baby has thrush, and so we're going to recommend that they do oh gosh, I can't remember it. So the violet stuff that I don't know why the word just left me. And they can also use breast pads, but that also can increase the risk of developing some yeast, because it's going to be a moist environment. It's really going to be up to the discretion of the mom if they want to use the breast pads or not. Breast shields. Said some things about breast shields on here. Now, remember I said I had an IUGR grandbaby. He had the tiniest little mouth ever, so he could not use a standard breast shield. We had to get a much smaller one for him. You can use breast shields for sore, flat, or inverted nipples, or in her case, his little mouth was so little he just could not. And this is just what we have going on. Some women are extremely large breasted, and she was. So when milk came in, made it even worse and made it very difficult for him to do any latch. So there was a lot of working that she had to do with him to get him to latch to the breast itself versus the nipple, the breast shield. But the breast shield works for a while. We don't want to use it forever, though. It's not something you want to do. You want to use the breast shield for a short period of time and start working your baby off of the breast shield and onto the breast. Because them latching on to the breast and getting the areola and the nipple into their mouth is what is going to help to stimulate you. You have to resume self-care. Self-breast exams. Only 1 to 2% of breast cancer is diagnosed during pregnancy and lactation, but we still need to make sure that they're doing self-breast exams. Menstruation will usually resume by 6 months postpartum. And sexual relations, sensations may seem different. This all comes from your book. It's all going to be individualized. That's just, if a patient asks me about it, I do talk to them about it. It's not something that it's not a typical subject that we bring up in nursing, and I don't have any reason why. The baby got here somehow. So, you might just, when you're doing some instruction, some teaching with your moms, let them know that it might feel a little odd. It might feel a little different. They might not want their breast to actually be messed with, just because of the feelings that this is maybe, and this, I mean, I'll be very personal. I felt like that was during that 13 months when I breastfed. These belong to my infant right now, and I just didn't want to, because you get leakage of breast milk during arousal. So that is some things that you can convey to moms. Contraception, breastfeeding delays return of ovulation and menses, but not effective means of contraception. Again, I have 13-month apart grandchildren. Progestin is the only birth control pill that is less likely to interfere with milk supply, but so many different things interfere with milk supply. Even Mucinex, it interferes with milk supply because what does it do? It dries you up. Benadryl dries you up your sinuses. So all of these medications are going to have a hit to your breast milk, and those are things that you want to make sure that you convey to your moms as well. Breastfeeding during pregnancy, it's possible if there's no medical contraindications. The process of breastfeeding an older infant, older child, and a newborn is referred to some tandem nursing there. But breastfeeding during pregnancy is not harmful. I know that our pediatrician told my daughter she could continue to breastfeed the oldest one, who was just a few months old when she found out she was pregnant with number two. And her OB felt like it was okay, but she had to start weaning by the time that she was 6 months because what does breastfeeding do? When we initiate breastfeeding post-delivery, it causes what? Uterine contractions. So with uterine contractions, we not that we're going to send a mom into preterm labor. I don't think that that's going to happen. But here's the thing. She was also a primary C-section with the first one. So her uterus was not even completely healed when she got pregnant with the second one. So that is why that they felt like that she could breastfeed for a certain period of time, but she had to start weaning down. And she really didn't want her feeding past 4 months, but she told her that if she needed to, she could go to 6 months, but it was done cautiously. Some additional consideration, diabetic mothers. What do we know about gestational diabetes? We talked about this. We even had a discussion board on this. They're encouraged to breastfeed for the anti-diabetogenic effect. So a mom will still have lower insulin needs when she is breastfeeding. Drugs in breastfeeding, radioactive agents and smoking, alcohol, caffeine, all these things will pass through the breast milk. And you'll find some moms that say, oh, it's okay to go ahead and drink while I'm breastfeeding. And there are different research studies out there. I'm not going to get into it because it's too much. It goes back and forth. One group says yes, you can drink. The other group says no, you cannot drink. With smoking, I kind of had to take this opinion when my stepson his ex-girlfriend delivered their child, and I freaked out when I saw her smoking post-delivery and breastfeeding. And then I just thought, well, why am I freaking out? Because she smoked all during the pregnancy, so Aiden's already received all of this nicotine in his system. He's probably going to have withdrawals if she stops breastfeeding or stops smoking at this point in time. So, I mean, if they've been smoking during pregnancy and they're continue to smoke, the baby's going to still get the effects. They've already had it during the pregnancy. Doesn't mean we all have to like it as healthcare professionals. Environmental contaminants such as insecticides and products used in dry cleaning can also affect and pass through breast milk. So we have to be very careful about the things. So engorgement, sore nipples, plugged milk ducts. First, schedule feedings, pump small amount to encourage letdown. We want to do warm showers on the breast to release some of the milk if they're engorged. if they have sore nipples, have their mother remove the infant from the breast, reposition the infant for better latch on, make sure that they're latching on correctly, and attempt to feed again. Make sure to release the infant suction to decrease the amount of trauma. Just stick the finger up in there and release that suction. Apply warm compresses and massage to encourage milk duct dilation when you have plugged milk ducts. Encourage the mother to feed before she starts feeling full. I used to, when I would have clogged milk ducts, I would put a warm compress to the breast, and as my son would breastfeed, I would massage that area with that warm compress to get that milk duct unplugged. So yeast infections, we have to treat both mom and infant with some antifungal agents. Mom's going to have some severe nipple pain. The nipples are going to be pink, they're going to be shiny, flaky, they're going to have a red rash. The baby's going to be fussy and gassy. They're going to have oral thrush and red raised diaper rash. We have to treat it, and there are some over-the-counter things that we can get, and there's some other things prescribed by a physician that we can give them as well. With mastitis, this requires attention by your healthcare provider. There's no ifs, ands, or buts about it. They're going to have a fever and they're going to have flu-like symptoms. The upper to outer breast will be pie-shaped, and it can affect one or both breasts. And you see how red this poor breast is here. Some moms will have mastitis so bad that they've tried themselves with antibiotics to treat it, antibiotics that are safe through the breast milk. And then we had them have to come back into the hospital to give them IV antibiotics. And unfortunately, at that point in time, they have to pump and dump their breast milk. Because when we give most of these IV antibiotics, they pass through the breast milk and they're not safe for babies. So, they still, even though they have mastitis, if they want to continue to breastfeed, they're going to have to pump through it, and they're going to pump those breasts, and they're going to have to dump that milk, and someone will have to supplement the baby. A lot of times Baptists will let the baby stay in the room with mom, but somebody, either her or someone else, and it may have to be someone else, because if she tries to supplement the baby might not actually take a bottle. Some predisposing factors for mastitis: inadequate emptying of the breast, they have plugged milk ducts, abrupt weaning, all of a sudden I'm stopping, wearing underwire bras, if they have sore cracked nipples, breast trauma, stress, fatigue, and poor maternal nutrition. We have to educate. We have to educate mom. Antibiotics and analgesics, adequately empty the affected side, warm compresses, cool compresses, adequate fluid intake, balanced diet, and rest. Those are the things that we have to do to hopefully to keep from having. And y'all, hey, listen, do y'all see my cabbage leaves up there on the screen? Let me just tell you right now, I learned this years and years and years ago, and it's pretty cool. But if you have a mom who is wanting to wean, maybe she's decided that breastfeeding is just not for her. She doesn't want to do it, but yet she's got engorgement going on. We need to relieve that. If you will put cabbage leaves on the breast, okay, and wrap with an ACE wrap, it helps. It helps with the pressure, the feeling. It helps to dry the breast up. It's a great thing to do for mom. So formula feeding, what are the reasons for it? Preference, family influence, culture, lack of familiarity, physical inability, contraindicated for any reason whatsoever, excuse me, HIV or infant condition, and adoption. Those are some reasons that we would do formula feeding. And listen, back on that formula feeding and the adoption being an option for why moms would choose it. You know, I had a mom once that I took care of, or the preterm infants in NICU. They're actually triplets, and they were from Britain. We have some lax laws on surrogacy over here, just FYI. But she, was the first time that she was able to do skin to skin with one of the neonates. And she was like, "Oh, he's rooting. What do I do?" So I actually got lactation in there because it's not necessarily that she can do breastfeeding, but there's actually special bras that they can wear where we can feed a tube down into it, or there's a tube fed down into it that formula can go through, and they might get some breast milk, some stimulation so that they can produce some breast milk. But mostly the infant is getting formula, and it is a way that they can breastfeed with the formula. It's really a great bonding experience for adoptive moms. So infant formulas, if you've ever bought formula, you know that is expensive as all get out. We have WIC programs, and they provide us with the iron fortified formulas if expense is a limiting factor. However, it may be a limiting factor, but it's also going to be limited on whether you can actually get it based on your income. So those moms and dads who make too much money that can't get on a WIC program, they're paying an arm and a leg for some formula. There's all kinds of different formulas and cow's milk. I'm not going to be testing on the different types of formulas. We're just going to talk infant formulas in general. For bottles and nipples, it's kind of this is just a basic hello, you know that you need to wash them in warm soapy water with a nipple brush. The reason why we use a nipple brush is because just shaking it out is not going to get the bacteria out of the nipples. We need to make sure we're washing them good, or encouraging moms to wash them. Boiling is only indicated if there's a problem with the water supply, and maybe if they have well water, they might want to boil the nipples and bottles in a pot of rose. It's important that we tell moms and dads not to alter the manufacturer's directions on the formula can. We don't want to use well water for it, but we also want to make sure that we're using fluoride enriched water when we're mixing it. So if they are on well water and they're going to have to supplement, they need to make sure that they buy water that has the fluoride already in there, or they're going to have, when their baby's teeth start erupting, they're going to have some awful teeth that are going to end up needing to be capped. Discard any unused formula, because what happens? Baby's mouth has bacteria in it, so we need to make sure we're ridding getting rid of the formula, because the bacteria is already backwashed in there. Babies may also need to be having vitamin and mineral supplements when they are on formula. Patient education on feeding readiness. First feeding is given after a bath, and this is a standard right now, but what did I tell you? I think, or I don't know if I did tell y'all this, but delayed bathing is actually promoting more competence and more success in breastfeeding. So I know that we're talking about formula, but delaying the bath after birth is going to help them with being able to breastfeed better. But if you're formula feeding, we're going to give it to them right after that. I usually drink 10 to 15 meals within the first week. And you'll find so many moms that are doing 30 and 45 and even 90 within that first week. The average intake is 90 to 100 by the end of the second week. We don't want them to microwave it. We want them to test their temperature. We don't want moms to prop the bottle. We want them to feed their baby with the head slightly elevated and burp several times during the feeding. We want to make sure that we're observing our mothers that are feeding their infants with the bottle and formula. That way that if there's anything that we're seeing and noting that they're doing wrong, that we can correct it then. Because you know that by about 4 months, they're going to start having a lot more spit up and regurgitation. So start out now feeding them in the correct position so that we can decrease that incidence. All right, thank you guys for listening. This is the end of the newborn nutrition, and I will upload this as a separate YouTube video.